Okay, so this presentation will be about pediatric vaccinations, and this is a rather broad topic, and I thought it would be a great opportunity to quickly kind of refresh some basic immunology related to vaccines, also go over the type of vaccines, the big groups there, and which vaccines are under each, little quickly about the mechanisms. Also review the CDC vaccine schedule for children, and I also thought this would be a great opportunity to talk about vaccine hesitancy and the role that we as family physicians really have there. So let's get into it. So first of all, a little basic overview of the immune system so we can understand how vaccines work. So a vaccine really mimics an infection. So we introduce the substance into our body. It will trigger an immune response where memory cells are formed, and these memory cells then stays in our body and will protect us from infections. And when it comes to the immune system, we have two kind of large divisions of immunity. We have our humoral immunity consisting of our B cells. We have our cell-mediated immunity consisting of our T cells. So the humoral immunity really works so that the B cells, they are able to recognize foreign substances, antigens, and in a response to an antigen, they will produce antibodies, and in that way maintain an immunological memory in our bodies. That serves as an important protection for infections for us. Then we have our cell-mediated immunity consisting of our CD4 positive T cells. They really help B cells to make antibodies. We also have our CD8 positive T cells that will directly kill virus infected cells. So, to the types of vaccines. First of all, let's talk about the live attenuated vaccines. The vaccines from this group are some very known ones are measles, mumps, rubella, polio, the Sabin type. We also have a Salk type, and the Salk is a killed inactivated vaccine. Then we have the yellow fever, influenza, the nasal spray type, and varicella. And this group really works as so we have the microorganism is alive but attenuated, so it cannot create a pathogenic response, but it can grow in our body, and it will trigger both our cellular and humoral immunity. And because of this, we have a really strong response. It's lifelong, but because it's live, we have to remember that it's contraindicated in immunocompromised patients and in pregnancy, where it otherwise can create complications. So our next group of vaccines are the killed or inactivated vaccines. So here we have cholera, hepatitis type A, rabies, and our influenza injection type vaccine. And these vaccines are killed and inactivated, but it maintains the epitope and the epitope is a part of the antigen that is recognized by the immune system. So that's how it triggers our protective response. So it's safer than a live vaccine, but it's weaker, and we may need a booster. And this one works mainly on the humoral, with a humoral response. Then we have our subunit type. Here we have hepatitis type B, pertussis, streptococci pneumonia, HPV, and meningococci. And subunit, they contain only the antigen that stimulates the immune response. So they are weaker, but safer. They're also expensive. And then we have the toxoid type vaccine. Here we have the Clostridium tetani, the Corynebacterium diphtheria. These are bacteria that are able to produce toxins. So how these vaccines work is that they stimulate the immune system to make antibodies that will neutralize those toxins so that they cannot create a pathologic response in our body. These vaccines also may need a booster. And now to the CDC recommended vaccinations for pediatric population. I inserted an image there where you can see all the vaccines that are given, at what age, and the different doses. And this one is from 2021. I was not able to really find a clear image from 2022. The only difference that I noticed, though, was that on the 2022 there was also the dengue vaccine mentioned, but that's really only given to children in areas where they would be at risk for that infection. But as you can see, we are given quite a few vaccinations at 2 months, and right at birth we're given the hepatitis B, and then at 2 months we're given the second dose of hepatitis B along with rota, diphtheria, tetanus, and pertussis, the Haemophilus influenza type B, the pneumococcal vaccine, the polio, and then we're given the second and third dose there at 4 and 6 months. And at about 1 year, we're given the measles, mumps, rubella, and the varicella. And then there are some other vaccines given at other ages and other doses at other stages, as you can see there in the picture. And babies are immune to some diseases when they are born because they have antibodies from their mothers. But this immunity only lasts a few months, and they really don't get enough protective antibodies against, for example, diphtheria, whooping cough, polio, tetany, hepatitis B, or Haemophilus influenza. So this is why it's very important to vaccinate a child before she or he is exposed to a disease. So that's why we give them at childhood, because this is also when they are at the highest risk for getting sick or dying from these diseases. They're also given at different times. Like I said, they're at 2 months for a few of them, or at a year for MMR and varicella. And that's really because those are the times where our immune system are mature enough to create a protective response. So we don't want to give MMR earlier than that, for example. It would not create an enough protective response. And given many at once, that is deemed safe to do. And also, let's talk about some contraindications and precautions that are, of course, important to know when giving these vaccinations. So severe allergy to a vaccine component is a contraindication, along with personal history of interception when it comes to the rotavirus vaccine. Like I mentioned before, live vaccines are contraindicated in immunocompromised children, weight under 2 kilos for hepatitis B in newborn. One that is clinically relevant on a daily basis, I'd say, is the current moderate to severe illness with or without fever, because we know that children, they have a lot of infections, colds, so it's important to know if you can vaccinate them or not on that day when they come with a cold. So if it's moderate to severe with or without fever, then that is a contraindication. But let's look at what's not contraindication. So a mild illness, which is a mild fever, is not a contraindication. Current antibiotic therapy is not either, and prematurity is not a contraindication. So we give premature children vaccines based on their actual age. So now let's move on to the topic of vaccine hesitancy. So this is a rather important topic, and the WHO deemed this one to be one of the top 10 threats to global health. This was in 2019 though, but it still kind of holds true. And they also mentioned microbial resistance and weak primary care. So these are all fields where we as family physicians can feel like we can make a difference and where we have important roles. So that's why I thought it was important to bring this one up. And vaccines, they prevent 2 to 3 million deaths a year globally. And measles has increased about 30% in cases globally in recent years. And this is not only due to hesitancy of vaccination, but partly in some countries that had eliminated some diseases through vaccines, they have seen a resurgence of these diseases, and that's pretty alarming. So one of the key reasons for hesitancy is lack of confidence, and this is really where we can come in with our knowledge and the fact that we come in contact with these parents that are concerned. And in relation to vaccine hesitancy, we have the vaccine paradox, and this is also a reason to vaccine hesitancy. So the more that we are vaccinated, the less people get diseases, of course, and people tend then to forget the severe complications of these diseases. And they then worry more about the complications of the vaccine than the actual complications or the severity of the disease. And this worry leads to a lack of confidence. So that's a pretty interesting phenomenon and something that's just important to be aware of. And vaccines, they have led to eradication of life-threatening or life-debilitating diseases. Smallpox is a great example. It was one of the most contagious and deadly diseases. It killed about 300 million people between 1900 and 1920. But it is now eradicated because of vaccines. And a lot of other diseases are not nearly as common as they were about 100 years ago, thanks to our vaccine program. So it's pretty safe to say that vaccines are one of the greatest medical advances in the history of medicine. And like I said, we really have a great role because we come in contact with these parents that might express concerns when it comes to the decision to vaccinate or not to vaccinate. So how we choose to talk to parents really matters. And therefore, I just thought it could be important to just touch on some topics because I feel like there's really no one right way in how to talk about this, but it's just good to maybe think through your own personal stance or how you want to really go about it to be prepared to face these parents. So because when we talk to parents about vaccinations, that has a positive impact. So that has been shown in studies, and there's one study, an American study from 2013, that showed that, first of all, if parents come into a vaccine appointment and they have some previous vaccine info, that really matters when it comes to increasing vaccine frequency. So they will be more likely to take your advice and get vaccinated. Also, how you phrase it will really matter. So if you ask the question, do you want to give your child a vaccine today, or how would you like to do? Well, that's going to result in a lower vaccine frequency. They will be less inclined to vaccinate their child if they are concerned from start, of course. But if you're saying today we're going to vaccinate them, that will, according to this study, result in more vaccine given. Of course, you have to be respectful, curious, and keep the conversation related to the parents' concern and really centered to them. And I think it's also important to keep in mind that it might be easy for us as physicians to just kind of take for granted that you feel very secure in where you choose to get your info from, that you feel secure in choosing a safe evidence-based source. But that is not the case for everyone in today's kind of information area, when we are just overflooded with information from all angles. It can be hard for some to really differ between safe sources, trusted sources, evidence-based sources. So it's something that we just have to be aware of. And like I said, I don't think there's any one right way in how to do it, but I think these are some ideas of topic to touch on when talking to concerned parents. And it's of course important to ask about their concerns so that you know the baseline and what to really how you can make them feel more confident in their choice. Of course, it's important to go over each and every vaccine to give accurate info and talk about the protection that's provided from each vaccine. It's also important to inform about the risk of rapid spread of infection amongst an unvaccinated population. And also, it's important to be honest about the risks. But there is really important to mention that there's really no thing that we put in our bodies that is 100% safe. Not even food, not even over-the-counter pain medication. So vaccines, though, it's important to stress that they are amongst the safest and most studied medications, or what you want to call it, and the risk for long-term severe effects are minimal, and the risk of dying from the disease that we vaccinate against are so much higher. So really be honest about those risks, but also really stress the safety. And like I said, these are some ideas. I think it's just something that is important to think through before you meet with parents that are thinking about whether not to vaccinate, and just also, like I said before, really remember your important role as a family physician here. So this was my presentation about pediatric vaccinations. I really hope that you enjoyed it, that you got something out of it. I really enjoyed making this presentation, so thank you.